Welcome to the Vitaminise Wellnest Clinic Phone Onboarding Masterclass. This 10-minute training will prepare you for excellence at our clinical front desk. A professional phone experience is the heartbeat of our clinic. Over the next 10 minutes, we will cover the standards, scripts, and systems that define the Vitaminise experience. Chapter 1. The 5 Wellness Standards. These core principles ensure every caller feels heard, valued, and safe from the very first ring. First, answer within 3 rings. This demonstrates promptness and respect for the patient's time. Never let a call go unanswered. Second, use our bilingual greeting. It must be clear, warm, and professional, immediately identifying our clinic and yourself. Third, capture everything. Every interaction must be recorded accurately in our practice management software for clinical and operational continuity. Fourth, provide a clear next step. Never end a call without the patient knowing exactly what happens next, whether it's an appointment or a callback. Fifth, lead with compassion. We serve patients who may be in pain or anxious. Your tone should be authoritative yet deeply empathetic. Chapter 2, your first 30 days. Let's walk through your onboarding journey and what to expect during your first week at Wellnest. Day 1 is about immersion and shadowing. By day 2, you will begin hands-on training with our EHR and practice management systems. Day 3 focuses on insurance verification. On day 4, we master the clinical triage tree and specific response scripts. On day 5, you will handle calls with support, followed by a performance review to ensure you're ready for the weeks ahead. Chapter 3. The core scripts. These are the bilingual foundations of our communication. Let's practice the primary scenarios. The greeting. Good morning. Thank you for calling Vitaminise Wellness Clinic. This is Elena. How may I assist you today? Always ask permission before placing a patient on hold. For callbacks, ensure you verify the patient's preferred number and name. For voicemails. Hello, this is Elena from Vitaminise Wellness Clinic. I am calling regarding your inquiry. Please call us back at 689-310-2613. Chapter 4. The 9 common scenarios. From new patient inquiries to billing questions, here is how we handle each situation. The new patient inquiry is our most critical conversion point. Follow the 8-step path, verify service, insurance, and provider availability. For existing patients, always verify 2 identifiers before discussing their clinical or billing information. Prescription refills require the pharmacy name and medication details. Remind patients of our 48-hour processing window. Lab results. Never share clinical data without absolute identity verification and adherence to our HIPAA protocols. For telemedicine calls, guide the patient through the link access and ensure they are in a private, safe environment for the call. Our weight loss program is highly sought after. Be prepared to explain our approach and schedule initial consultations. Aesthetics and Botox calls require specific provider knowledge. Know our current pricing and provider availability at all times. Sales calls. Be polite but firm. We do not pass sales calls to the clinical staff. Offer our general business email instead. Urgent symptoms. If a patient reports pain or emergency symptoms, stop and follow the triage protocol immediately. Chapter 5. The Data Capture Checklist. To provide the best care, we must have these 10 pieces of information for every new appointment. Start with the basics: full legal name, date of birth, primary phone number, email address, and insurance carrier. Followed by physical address, preferred pharmacy, referring physician, detailed reason for the visit, and how they heard about us. Remember, these 10 items are mandatory. An incomplete profile is a barrier to safe and efficient patient care. Chapter 6. The Clinical Triage Tree. This logic map is your most important tool for ensuring patient safety. The golden rule: when in doubt, prioritize safety. If you are unsure if a symptom is an emergency, treat it as one. Level 1, 911 emergency. For chest pain or shortness of breath, instruct the patient to hang up and call 911 immediately. Level 2, urgent support. For sudden pain or high fever, escalate to the clinical staff or schedule a same-day urgent visit. Level 3, concerning symptoms. Persistent symptoms that require a provider's attention within 24 to 48 hours. Level 4, routine care. Annual physicals, long-term follow-ups, and routine refill inquiries. These can be scheduled for next available. Chapter 7, HIPAA and compliance. Protecting patient privacy is not just a policy, it is a legal and moral obligation. Always verify identity before disclosing any information. Only share the minimum necessary to assist the caller. Never discuss patient details in public areas or with unauthorized persons. Maintain a quiet, secure environment for every call. Log out of your station when leaving your desk. Your digital security ensures our patients' trust and safety. Chapter 8. Services and Pricing. Transparency in pricing builds trust and reduces billing friction later. Know our current self-pay rates and consultation fees. Always inform the patient of balances due at the time of scheduling. We accept most major insurance plans. Use our practice management grid to quickly verify a caller's coverage. For high-balance services, always mention our financing options, such as Care Credit, to assist our patients. Chapter 9, Common Q&A. These are the most frequent questions from our callers and how to answer them with authority. Question: Is Elizabeth a doctor? Answer: Elizabeth is our medical director and lead clinician, specializing in primary care and aesthetic wellness. Question: Can I get Zepbound or other medications? Answer: Access to all clinical programs requires an initial consultation and provider evaluation. Question: What are your office hours? Answer: We are open Monday through Friday, 9 a.m. to 5 p.m. to serve our patients. Chapter 10, Daily and Weekly Checklists. Consistency is built on these small repeating actions every single day. Your morning starts at 8:30 a.m. Ensure phones are live, the EHR is synced, and all voicemails from overnight have been returned. The day ends at 5 p.m. Finalize all documentation, confirm tomorrow's schedule, and forward phones to our after-hours service. Fridays are for weekly reviews. Audit your pending follow-ups and review your call metrics to prepare for the coming week. Chapter 11, the 30-day knowledge check. This milestone ensures you have mastered the wellness standards and are ready for full autonomy. This check covers clinical triage accuracy, conversion rates, and protocol adherence. It is your gateway to clinical excellence. Once completed, your sign-off confirms your commitment to the highest level of patient care at Vitaminise Wellness Clinic. We measure response time, keep our average ring time under 3, and return all voicemails within 4 business hours. Verify provider availability. Never leave a patient without a follow-up appointment. We track growth, aim for excellence in new patient conversions, and maintain our industry-leading patient retention rates. You are now equipped with the tools for success. Thank you for your commitment to Vitaminise Wellness Clinic. Let's make every call count.